I like to be in control. So when I ended up in the ICU at 27 years old, pregnant, and with a blood clot that had destroyed my bowel, I was terrified. I was so afraid I was fighting everyone around me. I kicked a nurse. I was trying to pull my tubes out. They had to chemically paralyze me and put on restraints. All I can remember in the haze of those 11 days were the voices of my family members who never left my side. After 2 surgeries, many procedures, and the loss of my child, I finally came out of the chemically induced fog. I still had the breathing tube in when my surgeon came to check on me. I wanted to thank him for saving my life, but I couldn't speak, and I didn't know his name. 6 weeks later, I came out of the hospital and everything had changed. I had lost so much energy. The right side of my body felt like it was no longer mine because of the central line and the ostomy bag. But I was alive, and 2 weeks later, I went on family vacation for Christmas. Since that time, I have had many experiences with the healthcare system. I have had interactions with surgeons, housekeeping staff, hematologists, lab techs, gastroenterologists, nurses, radiologists, food services, emergency docs, porters, rheumatologists. In one day in the hospital, I can easily meet 20 new people. Most of these people know who I am and a lot of personal information about me. I know this because once I was being pushed to an X-ray appointment in a wheelchair and my chart was placed in my lap. I flipped it open and was looking through it at my entire health history before the porter exclaimed, "Hey, you're not allowed to look at that." After that, I started feeling a little more vulnerable when I was in the hospital, knowing that most people knew so much about me and I didn't even know their name. 19 years after that fateful ICU visit, I now have an amazing daughter, and I am an active patient advisor with Alberta Health Services. I wanted to give back to the system that saved my life and helped me so much over the years. I also want to help improve the system so that other patients feel less vulnerable and more part of their care team. I don't think patients want to go on such a personal healthcare journey with healthcare providers they don't know. How can they ask the right person the right question if they don't know their job? How can they feel a part of their healthcare team if they don't know what each person's role is? How can we thank you if we don't know your name?